Good day everyone, Dr. Preetham here, consultant urologist, Uro Oncologist from Sparsh Hospital, Yelahanka. Today we'll be discussing about CA prostate. What are the signs, symptoms, and then how can we detect it early and then get treated for it and then get rid of it. A prostate is a small walnut-shaped organ which is presently sitting on the bladder and neck, and its main function is to produce semen. Most of the times, like 40 to 50% or even more, patients do not have a very good or a very significant symptoms because of CA prostate. But yes, some of the people can notice a few subtle changes in an urinary or in sexual symptoms, and few of them is like increased frequency of passing urine, or frequent getting up in the night to pass urine, or they may have a reduced stream, or they can have a strain to pass urine, or incomplete voiding sensations. These are a few symptoms which can be seen in patients who develop an early symptoms, early disease CA prostate. And along with that, patient may also present with hematuria, like a few drops of blood in the urine, or they can have a burning sensation while passing urine. These are other few symptoms which can be seen, which can also be seen actually. And yes, we also know that these are the main symptoms which are seen even in BPH. But yes, we should not forget about CA prostate. It has to be properly evaluated. To meet a nearby urologist. And what we urologists do is, we do an general examination and also the external genital examination, and also we do digital rectal examination, where we feel for the prostate and also see for the size of the prostate. And when the prostate is increased in size, or when the consistency has become harder, or there are a few nodules over the prostate, we feel it could be because of CA prostate, and then we order few tests. And what are these tests? PSA. That is the foremost and then most important of all. And this PSA will be elevated in the presence of an CA prostate or an infection in the gland. And we also do a total PSA and free PSA to rule out these things. And even if the PSA is still high, then we also do an MRI of the prostate to identify is there any lesions in the prostate. And then he requires a further evaluation, which the urologist will help you out. It is better to get treated when it is smaller or in its earlier stages, rather than repenting later on when it becomes a metastatic CA prostate. So please meet an urologist when you develop these urinary symptoms as early as possible. Thank you.